Hi, I'm Stephanie Davila, one of the speech language pathologists here at Easter Seals. I wanted to talk to you about what speech therapy looks like at Easter Seals. I know what you're thinking, babies don't talk, but by the time the toddler is 2 years old, they should be using 200 to 250 words. That doesn't just happen overnight. The truth is, communication begins long before a baby says their first words. For example, an infant will cry when they are hungry or they're wet. How a caregiver responds to the baby lets the baby know they're communicating effectively what they need. So you're probably thinking, what are some activities I can use at home to help my child's communication skills? Well, for example, reading stories, singing songs, pretend play, or simple turn-taking activities are all great ways to encourage your child to communicate. For example, for younger children, a simple book like this is a great way to teach your kids what pictures are. You can help them point to pictures as you name them. As a child gets older, you can move to simple books like this one. You don't necessarily have to read the story, but you can simply talk about the pictures, ask questions, and have your child talk to you about what they see in the book. For turn-taking activities, you can use a simple shape sorter like this one. You can have your child ask for the pieces, name the colors, name the shapes. You can also ask your child to hand you a specific shape or a specific color. Pretend play is another great way to encourage your child's communication skills for daily routines. For example, you can use bowls or spoons that you have in your kitchen to work on mealtime routines. You can teach your child about asking for more food. You can encourage your child to put their plates away, to throw their trash away. This all helps both the child learn words and understand the routine. And it doesn't have to be baby dolls. You can use dinosaurs, cars, action figures, whatever interests the child in pretend play. As a parent, you may be thinking, when do I need to call for a speech evaluation? With some children, a speech or language delay has a clear cause. For example, certain medical diagnoses or frequent ear infections, but many times children are not talking and do not understand directions, and we don't understand why. It's important to understand that communication skills look different for every child at every age. But if you feel your child is not communicating or understanding, then you can request a speech language evaluation. So what does speech therapy look like in ECI? We use a play-based intervention to work through daily routines. We use play to help your child learn words and understand the world around them in their daily routines. We include the caregiver in the planning and the treatment of that child. We'll come in, look at daily routines where your child is struggling, and help the caregiver create opportunities for that child to talk. For example, if a 2-year-old is only pointing or grunting when they are hungry, we can work with the caregiver to help that child learn to use gestures, signs, or words to communicate that they are hungry. We can also model communication skills and opportunities in other daily routines to help your child learn to communicate. This can help the child and the caregiver feel less frustrated during the day. Expressive communication delays are the most common delays in early childhood intervention. If you feel your child is struggling, please give us a call. Thank you for watching.